Early on, as a young child even, I knew I wanted to be a nurse, So when I became a nurse, I really, even going through school, wanted to be in labor and delivery. It was just always something I felt passionate about. I mean, I had 3 of my own kids at that point, and so that was sort of where I knew I was going to end up. And thankfully, right out of nursing school, I was able to get in as a labor and delivery nurse, and I worked there for 13 years. I had thought about going on to school for something, and the idea of leaving labor and delivery, I knew that wouldn't be right for me because I loved labor and delivery. And so I'd kind of done some research and learned about midwives. And so that's sort of why I kind of went on that path, so that I could still have the labor and delivery, but yet you also get the clinic, you get to kind of become part of these families' lives. And it's just really been a blessing. Even when I was in midwifery school and I had my first delivery as a student, I was just like, it touched my heart, and I'm like, yep, this was the right thing for me to do. I just knew that this is where I wanted to be. My role at Reedsburg Area Medical Center is as a certified nurse midwife. So some midwives people know as community midwives, and they deliver in homes, which is great for some people. I had always worked as a labor and delivery nurse, so I like the option of women being able to have a midwife, but in the hospital setting. So they can still have an epidural if they want an epidural and those types of things. With this role, I will be seeing patients in the clinic, whether that's a well women visit or during their pregnancy. Sometimes it's for problem visits or contraception visits, those types of things. We can kind of see women all throughout their life. And then also get that side of doing the prenatal visits and following them throughout their pregnancy and postpartum, and being there for deliveries, and just becoming part of their life throughout. And being able to be a provider in the small town community is super exciting, because you get to know your patients a lot better than when you're in a big city setting. Oh, there are so many things that are rewarding being a midwife. It's the idea that you're there for this special day for someone. Sometimes you have to be really hands-on with people, and you are kind of their main support system during this process. Sometimes they have a great support team with them, and you take a little bit of a step back, but it's kind of feeling that out and seeing what the patient needs, and what they need in one moment might not be what they need in the next moment, and so kind of being able to, empower women to, make decisions for themselves, and know that it's not me telling you what we need to do, but it's, here's what the options are, here's what I would recommend, but what are you feeling, and being able to kind of make some of those decisions during your labor process or during your pregnancy, and also giving you education so that you're making the right choices for yourself, and they're well-informed choices, but ultimately you get to make the decision on what type of care works best for you. Well, I'm originally from Wisconsin, and so I'd worked as a nurse in Wisconsin Rapids, which is a smaller facility similar to this. And then I became a midwife, and I worked for a short time at Marshfield Clinic Health System. And then I had moved down to Florida for 4 years. And then in Florida, I worked at a very busy practice in Tampa. We did like 7,000 deliveries a year, and so it was great. I learned so much. I worked with great people. I had great midwifery support. But I feel like when you come from a smaller town area and knowing the community and being part of the community and kind of taking care of your neighbors, for instance, and things like that, there's just a different feel to that. And I even, still have women that will message me that I delivered in Marshfield that are like, I'm having another baby, I wish you were here, that type of thing. So, it's just the bond that you get with that. You can't ever find that when you're at a big facility. It's just different. And so, for us to have the opportunity to come back to Wisconsin, the Midwest, which is where ultimately my family decided we wanted to be, was just this opportunity popped up, and so it just felt like the right fit for us, and my husband and children agreed, and that's why we're here. Outside of work, my family and I, one of the things we've done for years is host exchange students from all over the world. I have 5 children personally, but I have all these children from all over the world as well that come back to visit, and we go to visit them, and we've hosted from several different countries, and we just find it super exciting to share our life and also experience a little bit of their life too, and meet their families, and visit their homes and things like that. My older kids also have traveled the world, and my daughter right now finished nursing school, and so she's traveling Asia, and she's, you know, visiting these amazing places that I haven't gotten to go to yet, but it's just like to have that passion for travel, I think is so exciting, and to be able to, you know, go and do that and see new cultures and different things and experience different even foods and stuff like that. It's just, you know, neat to realize that there's such a big world out there. You know, you can have your home base that you absolutely love, but yet, you know, just exploring.